So, you're a new parent, or about to be one. You've probably heard it a million times. The first month is just a total blur. Well, today we're going to break it all down. This is your practical guide to not just survive those first 30 days, but to actually navigate them. Let's dive in.
Yeah, let's just be real for a second. This quote, it probably hits a little too close to home, right? Your baby is amazing, they're perfect, but you feel like you've been hit by a truck. It's so overwhelming, it's exhausting, and you know what? It is 100% normal. You are so not alone in feeling this way.
Okay, so here's what we've got on tap. We're going to cover the essentials, the daily loop of feeding and sleep. Then we'll get into the good stuff, how to soothe a crying baby. We'll also talk about taking care of the adults. Yeah, that's you. And we'll wrap it all up with a super important safety checklist.
All right, let's jump right in. First up, the two things that are basically going to take over your entire life for a little while: feeding and sleeping. This is the 24/7 cycle of newborn care, and getting a handle on it, or, at least understanding it, is absolutely key.
Learning your baby's first language, it really all starts with their feeding cues. And here's the thing, crying is actually a late sign of hunger. What you want to look for are those early, subtle signs. They start stirring, maybe they open their mouth, or they do that rooting thing where they turn their head looking for food. And on the flip side, when they're full, they'll just let go, turn their head away, and you'll see those tiny little clenched fists start to relax. It's like learning a whole new language.
And just a heads up, they feed a lot. We're talking 8 to 12 times in a 24-hour period. And a schedule? Yeah, just forget about that for now. It's not a thing yet. You'll also want to be ready for something called cluster feeding, especially during growth spurts. It's when they want to eat, constantly for hours on end. It's intense, but it's totally normal. It's just their way of putting in their order and telling your body to ramp up milk production.
Which, of course, brings us to sleep, or more accurately, the lack of it. And this piece of advice right here, it's honestly one of the biggest game changers for new parents. See, you're not going to get a full night's sleep, and if you keep chasing it, you're just going to get frustrated. So you have a choice. You can be tired and angry, or you can just be tired. And trust me, just tired is so much easier to handle.
So, okay, how do you actually do that? How do you manage? First, teamwork. Take shifts with your partner. It's everything. And you know that old advice, sleep when the baby sleeps? It's a cliche for a reason, because it's true. A nap is way more important than that pile of laundry right now. And please, rock your baby to sleep. Don't worry about bad habits. This first month is not about training, it's about survival. Pure and simple.
All right, moving on. Let's tackle what might just be the single most stressful part of this whole new parent gig: figuring out how to soothe a crying baby. It can feel impossible sometimes. But the good news, there's actually some really cool science that can help us out here.
It all comes down to something called the transport response. It's this ancient evolutionary reflex that's basically baked into their DNA. When you carry your crying baby, you're not spoiling them. Not at all. You're literally tapping into this deep, hardwired survival instinct that helped little ones stay quiet and safe millions of years ago. How cool is that?
Okay, so scientists actually took this idea and created a step-by-step method, a little recipe for calm. Here it is. Step 1, pick up your crying baby. Step 2, walk around with them for 5 solid minutes. This is what triggers that transport response. But here's the magic trick. Don't put them down yet. Step 3 is to sit down and just hold them for another 5 to 8 minutes. That little pause lets them drift into a deeper sleep, which makes the transfer back to the crib, way more likely to succeed.
Of course, that's not the only trick in the book. You want a whole toolkit, right? So think about anything that mimics the womb. A nice snug swaddle, a soft shushing sound close to their ear, gentle swaying. Oh, and a warm bath can be a total reset button for both of you. And seriously, never, ever underestimate the power of some calming music or just some simple white noise.
Okay, deep breath. The baby is calm. For now. So let's shift gears and talk about the other important people in the room, the adults. You guys. Taking care of yourselves isn't a luxury. It's not something you do if you have time. It is absolutely essential for everyone's survival and sanity.
And hey, partners, this is your time to be a superhero. Your role is so crucial. And it's about way more than just holding the baby. It's about taking over chores. It's about being the support crew during breastfeeding, bringing water, snacks, just being there. And that skin-to-skin contact, it's not just for moms. The research is clear. It's a huge stress reducer for dads and babies alike.
And there's something else we really need to talk about: postpartum depression.
It's not just something moms go through. Get this, up to 25%, a quarter of new dads can experience it too. This is so important. We have to be able to recognize the signs in ourselves and in our partners and know that it's okay to ask for help. It's a medical condition, plain and simple. It is not a sign of weakness.
Okay, last point on this, and it's for everyone. Learn the magic word, and that word is yes. When your neighbor offers to hold the baby so you can shower, say yes. When your friend asks if you need anything, don't just say we're fine. Be specific. Ask them to grab groceries. Ask them to fold that laundry. People genuinely want to help you, but they don't know how. You have to give them a mission.
All right, let's move into our final section. And this one is incredibly important. It's all about safety. Now, the goal here isn't to scare you. Not at all. The goal is to empower you. Knowing this stuff, having these skills in your back pocket, it can truly make all the difference.
Let's start with safe sleep. It's as easy as ABC. A is for alone. Your baby should be alone in their crib or bassinet. No blankets, no pillows, no bumpers, no cute stuffed animals. B is for back. They sleep on their back every single time. And C is for crib. A safe crib or bassinet with a firm mattress. That's it. Following the ABCs is the best way to reduce the risk of SIDS.
Okay, next up, what to do if an infant is choking. First thing you do is lay them face down along your forearm, making sure to support their head and neck. Then you're going to use the heel of your other hand to give up to 5 firm back blows, right between their tiny shoulder blades.
And you can see exactly how to do it right here. Getting the position right is so important. See how the baby's head is lower than their chest? That lets gravity help you out. And resting your arm on your thigh gives you the stability you need to deliver those blows effectively.
Now, if those back blows don't work, you immediately flip the baby over onto their back, still resting on your forearm. You'll place 2 fingers right in the center of their chest, just below the nipple line, and give up to 5 quick, firm chest thrusts. And you just keep alternating. 5 back blows, check, then 5 chest thrusts, check, until that object comes out or help arrives.
And here's what that looks like. Again, notice how secure the baby is, supported by your arm and leg. That 2-finger technique is really precise, targeting the pressure right onto the breastbone.
And finally, infant CPR. Now, this is only for a situation where a baby is unresponsive and not breathing, okay? So first, check if they'll respond. If not, you immediately shout for help for someone to call emergency services. Get them on a firm, flat surface and gently open their airway. You'll start with 5 rescue breaths, and then you begin the cycle. 30 chest compressions, then 2 breaths, over and over.
Here you can see 2 of those critical moves side by side. On the left, that gentle head tilt and chin lift to open up the airway, and on the right, there's that 2-finger position again, this time for compressions. You want to press down about 1/3 of the depth of their chest.
Look, that first month, it's a total whirlwind. It's chaos, it's a massive learning curve, and it is exhausting. But it's also packed with these tiny, incredible, unforgettable moments. Just remember, you're learning, your baby's learning, you're both figuring this out together. You're gonna find your rhythm. You absolutely 100% have got this. And when all the chaos finally settles and you look back, what do you think is gonna be your favorite memory from this wild and wonderful first month?